Welcome to Shore Medical Center's training video for computerized provider order entry, otherwise known as CPOE. In 2014, Shore Medical Center moved from handwritten paper orders to providers entering orders electronically into Cerner. This clinically led project proved to be beneficial in many ways. Here are some of the benefits we've seen with CPOE. Transcription or interpretation errors are eliminated. Verbal order entry is decreased. Providers can now enter orders remotely rather than giving telephone orders to a nurse. Automated transmission of orders to servicing departments provides immediate communication. Time searching for charts or forms is decreased. Evidence-based order sets promoting standards of care are readily available. Real-time alerts related to allergies, duplicate orders, and drug interactions are triggered. Our presentation is divided into 6 modules so that you can complete each module at your convenience. We will cover the following topics in this video. Required nursing documentation related to CPOE. Order profile overview and navigation. Nurse order review for new orders. Adding individual orders. Adding a power plan. And interacting with existing orders. Required nursing documentation related to CPOE, Module 1. There are key components necessary to facilitate efficient order entry. Upon admission, the nurse caring for the patient is expected to enter the patient's height, weight, dosing weight, allergies, home medications, and preferred pharmacy into PowerChart. These can be entered using the designated sections within the intake form. The patient's preferred pharmacy can also be accessed via the icon located in the toolbar. Let's talk about some of the key components and how they impact CPOE. As we've stated in our introduction, one of the advantages to CPOE is real-time alerts related to allergies. For this reason, it is critical that patient allergies be documented upon admission. Allergy information carries over from previous encounters here at Shore. Therefore, any previously documented allergy should be reviewed with the patient and updated appropriately with each encounter. Height, weight, and dosing weight are completed in the vitals section of the intake form. On admission, weight and dosing weight would be the same. However, there may be a point during the patient's hospital stay that the provider places a dosing weight update order. He may want one of 3 options designated in his order. He may want you to weigh the patient and record that weight. He may want you to document a specific weight for the patient, or he may request that you document the last charted weight in kilograms. Your documentation would be completed on the dosing weight form in the ad hoc folder. Dosing weight is a critical piece in weight-based medication orders. Documentation of home medications or medication history is required before the provider can complete his admission med reconciliation. Once the medication history is completed, a green check mark will appear next to the meds history in the reconciliation status box. Admission and discharge reconciliation will display with a green check within the status box once they are completed by the provider. In addition to height, weight, dosing weight, allergies, home medication, and patient's preferred pharmacy, the order entry details form should be completed on admission and once a shift thereafter. It must also be completed should there be a change in patient status impacting order details. Here's an example. The physician inserts a central line and checks may use IV line for labs. A new form should be completed by the nurse, designating Nurse Collect as yes. The data from this important form automatically populates the orders to provide better communication between caregivers. This concludes Module 1.